Okay, so a very good afternoon to one and all. So welcome to today's webinar on Mental Health Care Act 2017, its implications in psychiatric care. So we are fortunate to have Mr. Bivin JB as the speaker for today's session. So he is currently working as a psychiatric nurse in the Forensic Psychiatric Division of Government Mental Health Center, Trivandrum, Kerala. And also he is pursuing PhD under the National Consortium for PhD in Nursing by the Indian Nursing Council. So he has completed his BSc Nursing from Tamil Nadu Dr. MGR Medical University, and he has completed his MSc in Psychiatric Nursing from the prestigious National Institute of Mental Health and Neurosciences, Bangalore, in the year 2011. So he is having experience in both teaching field and the clinical field even after the MSc. So previously he was working as the assistant professor of psychiatric nursing at Mar Baselius College of Nursing, Kodamangalam, Kerala. And right now he is in the Forensic Psychiatric Division. So we have got the right person to discuss about the Mental Health Care Act 2017. Maybe as we all know, it is not yet included in the syllabus. So it is a new law related to the mental health in the India. So with I'm proudly inviting Mr. Bivin Jos to start the session. Please, sir.
Thank you, Jinto. I express my gratitude to Institute of Nursing, Pioneer University, for allowing me to have this interesting session. And it's indeed, as Jinto sir has said, it is indeed to know about the law or current legislation regarding to mental health care in India. Because we are not allowed to practice without knowing, merely ignorance is not allowed to practice or to be neglect in mental health care. So it is indeed needed for us to know what is there in the Mental Health Care Act to protect the individual with mental illness. It would be always needed. So to introduction. So India has had a convention with the United Nations Conventions in the on the rights of persons with disabilities in October 2007, and as our country is a signatory to this UNCRPD, we have to harmonize all our existing law with this UNCRPD. So UNCRPD basically inducted our country to follow our own laws to be disabled friendly. So that's why after 2007, after about 7 years later, in March 2014, Rajya Sabha has passed the mental care bill, and it is even passed after 3 years in Lok Sabha, and it was signed by our Honorable President of India in 7th April 2017, and the Act came into force in May 2018. So since May 2018, it has been 2 years. The Act is, so Mental Care Act is the law of our land. So why a mental legislation is needed? So mental legislation or any kind of legislation is an aid to individual to seek appropriate care. So many of the medical bill even help the individual to have an appropriate care. So here, many of the time, many reports says that person with mental illness, here I'm abbreviated as person with PMI, has a problem with accessing, has a huge human rights violation happening in the mental care institutions. So basically, a legislation in terms of mental health care would be helping the individual how to have a protective human rights by seeking care. And next is to address the stigma associated with the mental illness. So mental illness is the most haunted kind of illness, having stigma, social stigma, and even psychiatric mental professionals even being the prey for this stigma. And even mental health legislation would be helpful to have quality health care for persons with mental illness. So how and what are the basic of the Mental Care Act? So as you all know that we have a Mental Health Act, MHCA 1987, 30 years before. So why we need a recent updation to this Mental Health Care Act 1987? So what are the basic principles behind this Mental Health Care Act? So basic human rights is basic guiding principle behind formulating this Mental Health Care Act, and which gives the person with mental illness to have liberty, equality, and dignity to have quality care. And the second guiding principle in Mental Health Care Act and its subsections are individual capacity to make decisions. This law says that all individuals, either a normal person or a person with mental illness, has the capacity to make decisions for his treatment, to live in the community, something like that. So it completely relies upon a person's individual's or individual's capacity. So next guiding principle is will and preferences versus best interest. So here what I'm going to say is that will and preference of the person with mental illness is higher prioritized than the best interest of the therapist. So what I mean that the person has full authority to have will and preferences with regards to their treatment options than what psychiatrist is prescribing to the individual. So next would be autonomy. So autonomy makes the individual to have make choices. So how the recent or current legislation like Mental Health Care Act 2017 emerged. So as you know that the previously we have an Indian Lunacy Act which was passed in 1912. So which was almost a copy of the British laws and which primarily aims at the custodial care of the person with individual care. Custodial care means the person with mental illness were secluded away from the normal person or normal community to have a safe environment, and basically it aims at giving a safe place for the society, keeping the individual or lunatics having a mentally ill persons away from the normal society. But in 1987, so it was primarily aimed at treatment with person with mental illness. Actually, the advances in the psychiatric treatment or psychopharmacology gained attention to incorporate the treatment of mental illness into the Mental Health Care Act, which is passed in 1987. So, along with this, we have Person with Disability Act. So, as you know, that mental illness is the primarily responsible for disability for people who are living. So, Person with Disability Act 1995 directly applied or mostly preferably applied to people with mental illness. And we have after about 30 years later to Mental Health Care Act 1987, we have Mental Health Care Act 2017. So basically 2017 Act is on safeguarding the human rights of the treatment, human rights of the person with mental illness during treatment. So coming to the preamble. So what is a preamble? Preamble is something legislative term. So why we need a preamble is it is essential to read what is in a law. So basically it is like an abstract which is given an oral introduction or ethics which is being set by the legislating committee is set in the preamble. So while reading the preamble of Mental Health Care Act 2017, the Act clearly says, I've underlined a few points, to provide mental health care to the and services to the person with mental illness, and it is given during delivery the law is applicable, and the law is applicable during delivery and the incidental thereto. So basically Mental Health Care Act 2017 is focusing upon protecting the human rights of the individual while seeking or while in inpatient or seeking treatment. Okay. So now we are moving to the what is a Mental Health Care Act an overview. So we are aware that we have a Mental Health Act, National Mental Health Act 1987. We have 10 chapters, and while comparing to that, in the Mental Health Care Act 2017 has 16 chapters with 126 sections. So I have given some important chapters like chapter 5, rights of the person with mental illness, in the first slide, and I have given advanced directive, nominating representation. These are the novel terms which have been introduced by the Mental Care Act 2017. And coming to the next slide, we have the 11th chapter, which is saying about the mental health review board. So this also a tribunal agency which is proposed by this or is in the force through this Mental Care Act. So I would like to go through major salient findings or salient features of this Mental Care Act through the chapters. So next slide. So coming to chapter 1. Chapter 1 is termed as preliminary.
Hello sir, there was a technical issue. You can continue now. I will project the PPT.
Okay, thank you, Jetta. Okay, we are at salient features, chapter 1 preliminary.
Okay. So whether the slide is visible now?
Yeah.
Okay, please continue.
Okay. Salient features, I'll go through the main things which we need as a psychiatric professional. We are as a psychiatric nurse or a nurse who is having a general nursing or a degree in nursing. We are entitled under the title Mental Nurse in Mental Care Act. So we must know what is there in the Mental Care Act. So first one is regarding the preliminary section. These are mainly something regarding the Mental Care Act. Mental Care Act is the act which is applicable across the country, with all states and union territories need to follow this act. And definition, it has given definition for mental illness, advanced directive, nominative representative, and mental health professional, medical professional, many things, magistrate, many things. So something I need to stress upon that the definition of mental illness, it is important to be knowledge here, because the definition of mental illness says that if there is a substantial changes in the cognition, something like that. Actually, the problem here addresses the major or visible problems associated with the mental disturbances being protected under the definition of mental illness in Mental Care Act 2017. The problem is that it is included substances before us, but failed to include mental retardation as mental illness. And it says that the mental illness can be diagnosed based on the available diagnostic criteria. As a country, we are following the ambiguous diagnostic criteria. It is International Classification of Diseases, 11th version. And next one is, here we have definition of mental health professional under this Mental Care Act, Chapter 1, that it included not only the psychiatrist or a medical person having a psychiatric postgraduate degree as a mental health professional, but also it has included a person who in Ayush, Ayurveda, Unani, Siddha, homeopathy medicine, and having a PhD degree in Ayush are also entitled as mental health practitioners or mental health professionals under this act. So they have given due respect and right and have a due role in diagnosing and role in admission, discharge, and treatment decision process. And we have hospitals or treatment facilities which are primarily focusing, going renamed as mental health establishment under Mental Care Act 2017. So second chapter is mental health and capacity to accept mental health care and treatment decisions. So it is important why we need to, here the prime term is capacity. So capacity defines an individual's ability to take decisions about health treatment. Okay, so here this is under section 3 how the determination of mental illness being given, and it is usually mental illness of an individual experiencing mental illness is determined either by a medical professional or another professional. So as I said earlier, it is included the PG graduate having Ayush and along with the psychiatrist. And section 4 says what are the capacity to make mental health care and treatment decisions. So here, as I said earlier, it is an autonomy based on the daily principle here applied is the autonomy of the individual. Every individual has the autonomy to take decision for their own. So here, it is termed as otherwise termed as capacity. It is something different to an insight. So capacity is termed based on three defining criteria, like the person is understanding the information about the treatment information and appreciates the value of the information or consequences associated to the information given, and communication of choices and preference, and the person is able to communicate or choose what is appropriate to him. So it is something we can say like is associated with an informed consent. So here the person can choose the treatment, right to choose the treatment or refuse the treatment, and right to choose the best suitable to him. So the capacity, the treatment capacity or choose decision seeking capacity is determined by the medical and mental health professional based upon the guidance document for capacity assessment, which is available in the Mental Health Care Act website, and you can have a look at it when you have time. So coming to the chapter 2. So chapter 2 here the MHCA 2017 gives us a novel terminology, advanced directive. Advanced directive under section 5. So the person has the except minor has the right to have an advanced directive by writing, and it empowers the person, and it is based on the assumption that every individual, even the person with a mental illness, has the capacity to choose or make decision of their treatment choices. So in case the person doesn't have a capacity to have an advanced directive, the appointed team can have a decision on behalf of them. In case of minor, a legal guardian can have an advanced directive on behalf of the minor. Minor is termed as a person who is below the age of 18 years. So the process there, the advanced directive is not applicable at the time of emergency. I would say to the admission and discharge procedures, we have what is the terminology defined as, what is circumstances is termed as in emergency circumstances. And in an emergency situation, we need not have an advanced directive. We can go directly into the treatment options. And while I need comment on this advanced directive as a living will, so when we talk about the will is kind of the first only after the person is no more. But if this advanced directive is like we can call it as a living will, it will act when the person does not show capacity. So, and the important thing is, like the person, as we are all aware that mentally ill person have decision changes frequently. They are not in the same status of mood. So, the clause is that the latest advanced directive is valid directives, and it is the responsibility of the person or the person with mental illness or a nominated representative, Chapter 4 has the responsibility to produce this latest advanced directive while seeking treatment in a mental health establishment. So it is important how we need to do an advanced directive. Advanced directive is as simple as a person with mental illness can write it in a plain white paper, and it can have two witnesses, and this to be certified by the general medical practitioner that the person has the capacity to have an advanced directive. And the important thing is it should be registered to the Mental Health Review Board. So Mental Health Review Board is another chapter. I will tell in detail when coming to that chapter. So Mental Health Review Board is an quasi-judicial body which is being proposed by the Mental Health Care Act 2017. Next slide. Nominated representative, as I said earlier, is every person have a nominated representative except minor. Nominated representative will be acting as a person as a proxy when the person with mental illness loses his capacity to take decisions. So we have a default list is given under Mental Care Act, like if the person loses his capacity to take a decision for his treatment choices, the first to came into force is a relative, blood relatives or caregiver or a person from the mental health review board, or even these three are not available. The Director of Social Welfare Department of the particular state is considered as the nominated representative of the person with mental illness. So, nominating representative has many duties and responsibilities. He is working on behalf of the person, and he is working based on the current and past wishes of the patient. He must be knowing the cultural background of the person with mental illness and treatment decision. He can have a supported decision making. He can help the person having a treatment choices or decision choices while seeking treatment. And he can seek information. We have a separate section under Mental Care Act, which is coming under Chapter 5 regarding the rights that the person has the right to have information. So the nominated representative can seek information on behalf of the person with mental illness, and he can have he has the responsibility to seek rehabilitative services when the person is seeking discharge, and have the active planning discharge, and he can go for applying the mental establishment board for discharge or admission on referral, and he can give a consent on behalf of the person with mental illness while having a research program. So next is the major and very significant chapter in Mental Care Act, which is Chapter 5. So as we all can say that it is a heart and soul of the Mental Care Act 2017. So rights of the person with mental illness. So in when we check the Mental Health Act in 1987, we have only one section regarding the rights of the mental illness, which is very vague. So like the person with mental illness has the every rights of the a civilian enjoy. That's what 1987 section says. But here in 2017, an entire chapter is fully dedicated for the rights of persons with mental illness. So that is where we must be cautious about. So every right, if there is violation of the rights of the person with mental illness, we can sue for a medical or practice negligence. So first one is right to access to medical health care. Section 18 says that every person with mental illness has right to access the mental facility. So accessibility of mental establishment or mental facilities is always a problem for a person with mental illness. So as you all know, many of the psychiatric hospitals are located away from the city or suburb areas. And if you check, you can see, and there is a problem. So here, this law says that the person with mental illness should be accessible to the mental services, and the law clearly says that it is the responsibility of the state government to have an accessible psychiatric facility. So it is given some minimum guidelines, minimum requirement. Minimum needed psychiatric facilities for an individual with psychiatric illness. So it is and responsibility of the state according to Mental Care Act to provide minimum mental care facilities which is accessible to the mental ill person according to Section 18 under Chapter 5. So next one is right community living. The person, if we say that many of these psychiatric hospitals are function as an asylum model of care. The person with mental illness, even after treatment, complete stoppage of treatment, the person is no longer needed an inpatient treatment. The person with mental illness usually being abandoned and being neglected to rehabilitate into immunity. So here, every person with mental illness after being successfully treated has the right to have a community living. So it is the responsibility of the registered psychiatric social workers to rehabilitate the individual, to seek appropriate shelter homes or rehabilitative services, or the appropriate caregiver families to find out with family members and make them to a suitable rehabilitation process. And Section 30 says the right from the cruel, inhuman and degradation of treatment. So here the major thing I would like to say that here the person has the right to accuse it compulsory torturing. Torturing means shaving of head. It is seen that many of the psychiatric hospitals, like or a psychiatric hospital which is being associated to religious institutions, there is a practice of torturing the individual or shaving the head of the individual without their consent. So it is completely prohibited by law. And it is needed to be keep in mind. And right to live with dignity. Dignity means a person while in treatment facility, it is important to have an adequate space for the individual, adequate hygienic practices, adequate safe drinking water, food, and for the female person with mental illness has the access to have sanitary napkins and sanitary pads and diffuse of sanitary napkins and pads. So these are the things need to keep in mind. While we are practicing in a psychiatric hospital, it is important to manipulate settings according to Mental Health Care Act. Like this law is already into force. So we are always always can be sued if we are not aware and if we are not providing these type of facilities to an individual with mental illness under treatment. And also the person has the right to follow privacy. Particularly for female individuals have a separate beddings and this needs to be private. If we ever visit to a psychiatric hospital, there is common ward and it is not recommended under this law. Okay. So coming to the next slide. So the person must not be forced to work. If so, the person must be given adequate remuneration. This is also a very common practice in many of the psychiatric hospitals. That also, as a part of occupational rehabilitation, we can make the person to participate in the activities of the ward. But it is not compulsory. So, and also, if in case the person is making to participate in the particular activities, appropriate remuneration to be paid to the individual. This is the law says, and it is important to make the patient to wear their own clothes. Must not follow any kind of uniform in a psychiatric hospital, and any kind of abuse to be protected. The person must be protected away from any form of sexual or physical abuse. Section 21 says about equality and non-discrimination care, and under section of 21(4) says the inclusion of psychiatric person with mental or mental illness in the medical insurance facility. So nowadays, medical insurance is not applicable for many of the mental illness, and many of the person with mental illness are not known that the person can entitle to a medical insurance. So if this law says that a person with mental illness mental illness can go for insurance for their mental condition. Next is section 22 says right to information. Right to information applicable for nominative representative of the patient. So a nominative representative can write to the head of the department or head of the facility, mental health establishment, having the progress of the individual, the treatment available, treatment given to the individual, and it is the right to information. And meanwhile, the person has the right to confidentiality. Then here we have to be cautious about the breach of confidentiality committed for here. So it must be aware. We must be aware that the treatment related. So the information which can have a direct influence over the treatment must be kept in confidential. That is what I have to mention. Comment on these two words. And section 25 that right to access medical records. So medical records is right which is being questioned by many of the psychiatrists. Coming to the recent reports in many of the journals. But in law says the person with mental illness, even their nominal representatives, can have an access to the medical records. Even this to be returned to the medical MHRB, mental health review board in advance to have access to the medical records. Right to personal contact and communication. This is another thing we all practice. After practicing of it is important to have make a provision for communication, like either in a telephone or by email, to have communication. We must facilitate the individual mental illness to have communication with their relatives or persons while under treatment. And right to legal aid. So actually we have, as I practice in government mental centers, we have legal aid clinics and we have paralegal volunteers. They are in active process to seek helping the person to reintegrate in the community. So wherever the person with mental illness will be having problem to enjoy the civil rights, like enjoy their own properties. The person with mental illness will be, the properties of the individual will be being taken away by other relatives. The person will not be having insight, like something like there are issues with the legal problems while having an admission in the psychiatric facilities. Also, it is mandatory to have a legal aid clinic in every psychiatric facility or mental health establishment. So I failed to say what is meant by mental health establishment. So it is being defined clearly in the preliminary sections or in the chapter 1 that every facility which has partially or in fully treating or having an inpatient or outpatient treatment facility for directing to the mentally ill patients are entitled as mental health establishment. Also, some rehabilitation centers, so halfway homes, shelter homes, destitute homes, the home for beggars, like voluntary mentally. So all these establishments are coming under the title as mental health establishments. So it may be difficult for them to maintain a legal aid clinic available to all these establishments. So that law says that it's important to have a legal aid to every mental health establishment. Section 28, right to make complaints about the deficiencies in provision of services. It is another important thing we must be cautious about. The person with mental illness, either he is having a capacity or having insight or not, has the right to make the complaints about the provisions available to the individual at a psychiatric facility. So if he can go for in written complaints to the mental health review about that the person is not having access to communication, like there is no telephones or email contact is not available, or he is being secluded in a single cell, or the person having no safe drinking water, like this kind of internal grievances like can be processed by the person with mental illness. So law says that every mental health establishment should have an internal grievance redress mechanism to addressing to these kind of complaints which is raised by the person with mental illness. So we must be very much cautious about the rights of the mental illness. So we may be silly that the person is not known, person is not having insight, and he is insane to say or complain about the things which is available. But law says the person has the capacity to complain about the provisions which he has the right to accept. So coming to the chapter 6 is duties of appropriate government. So appropriate government states like, so there is a state or central government where the mental health establishment is attached to. So like an enhanced like Premier Institute is attached to central government facilities. There the appropriate government will be a central government, and when like where I practice the state government facility, it is the appropriate government is the state government or government of Kerala. So the duties of the appropriate government is mentioned under section 29 to 32. So like promotion of mental health and preventive programs is the main responsibilities of the appropriate government. So it is being practiced very fruitfully across the country through national mental health programs, as we are aware that it is kind of preventive program which is being successfully implemented across the country, but least is mentioned in this mental health care act 2017. And another important aspect of this important function of the state government and the central government is to creating awareness. So we must make awareness regarding the rights of the person with mental illness. So it should be freely either through flyers or handled. The person must be knowing about their own rights and seeking treatment in the mental health facility. And other main things like inspecting, registering, all those things are maintained and by this appropriate government, or the state or central government. which is termed as Global Government by the Mental Care Act 2017. So, seventh chapter is Central Mental Health Authority. So we have chapter 7 and chapter 8 regarding the mental health authorities. We have two separate mental health authorities like state mental health authority and the central mental health authority. We have actually it is already been there into practice. We have in Kerala we have state mental health authority. And the functions are almost similar, which is being mentioned under Mental Health Care Act 1987. So next chapter is finance, account and audit, and chapter 11 is mental health establishment. So under mental health establishment, what are things coming under orientation as mental health establishment, what are the process of registration, review, inspection of this mental health establishment, and the minimum standards to follow in mental health establishment meaning described under chapter 10. So these are now to be aware about these things for us. So I am skipping these things and directly coming to the Mental Health Review Board, MHRB. So Mental Health Review Board is an important thing which is considered as a quasi-judicial body. It is constituted under Mental Health Care Act 2017. So many of the individuals or the persons members of this Mental Health Review Board are from the legislation or legal side. So the primary function, Constitution is mentioned under section 73 and 24. The function of the key function, many of these functions are mainly directed or focusing to or controlled by this Mental Health Review Board under Mental Health Care Act. So in case of registering an adult directive, registering a nominated, appointing a nominated representative, all those things are directly the functions of the Mental Health Review Board. So the state government, or actually if you say the health is the matter of state, so every individual state has the right to make decision of their own in matters related to state. So the central government doesn't play major role in or influence in the state affairs, health affairs where the state making decisions. So this is what the Constitution of Mental Health Review Board is the affair of the state. So state can determine that the Mental Health Review Board can be constituted district-wise or otherwise based on the population density, something like that. So unfortunately, the law came into force in 2018. So we are still in an infancy stage to implement this law, and many of the states did not have a Mental Health Review Board. So, but we have examples or best models which is being proposed by many pioneer institutions. For example, in Enhance, we have an internal Mental Health Review Board, and many of the admission, discharge procedures, and this kind of advanced directory, nominated representative, everything is maintained through an e-program called e-Manasa. So internally we have an Enhance is maintaining a Mental Health Review Board. So Mental Health Review Board plays an important role regarding the legal side of the in terms of protecting the person's mental health illness. So next chapter is chapter 12 is on admission, treatment and discharge. So admission, treatment and discharge is almost the section numbers being changed, though even though the section numbers being changed, the basic things are similar to the Mental Act 1987. So we have two types of admission, like we have either before it was termed as voluntary and involuntary form of admission. Now it has been termed as independent admission and supported admission. So section 86 says a person with a capacity and having mental illness can directly apply for admission to a mental establishment. So which is under section 86. So we have no section to admit a person under 18 years or a minor, but we have different section. The admission of a minor is being mentioned in section 87, where a request is made by a legal guardian in terms of minor for admission. So here I would like to mention about the capacity which I said earlier. So here the role of capacity came into force. So here the independent admission is based upon that assumes that the person is having capacity to take their own decision to seek care or to seek treatment. So, but if in case the person doesn't have a capacity to make, the capacity, as I mentioned earlier, it is mentioned based upon the guidelines proposed by the Mental Care Act, which is available in the website, guidelines document for capacity assessment. So it is done. A mental practitioner, as I said earlier, a mental practitioner is not a psychiatrist alone. Even a PG degree holder in AYUSH also entitled as mental health practitioner, they can also have a capacity assessment. So they can also get the patient admitted in a psychiatric facility. So if the person, if mental health practitioner came in to know that the person doesn't lack of capacity, then
support admission and it must be below 3 days, so below 1 month. The support admission can extend up to 30 days. So after 30 days, so in between we are starting the treatment of psychopharmacology for maybe within a week or two, the person may can regain his capacity and the section 89 can be changed to 86 or 87. So that is something of this. And if the person is not regaining his capacity and treatment assistance cases, so the patient can be extended up to extended support admission and continuous support admission up to 90 days or 20 days or 90 days. So these maybe the decision may be done by 2 independent psychiatrists under Section 19, and these information to be informed to the managers will be more appropriately. So usually the admission and discharge procedure indicated to the consent review board within 72 hours under Section 86 and 87, and for Section 90, so supported and continuous supported admission and the admission procedures will be indicated to the important law fix. So the review board has the important function in registering this admission and discharge procedure. So we can challenge the admission when the person with mental illness can challenge the admission so that he is being in a psychiatric facility without having appropriate. Then having it, he can challenge his admission directly to the mental illness. That is the awareness to the person with the mental illness, and that is what the right way this law is to the person with mental illness. And that is about the admission. So we have got the 2 types of admission, like the independent admission and support admission. Support admission maybe about within 30 days, or if the extent maybe developed and this support admission, and this support admission is determined by 2 independent psychiatrists or mental professionals, and it should be indicated to the mental review board appropriately. And Section 90 of the Day of Access Act, it was also mentioned in the Mental Act 1987, like the review of paramour something like that. So these same things happen in the case. And the person can write to the mental review board or to the head of the institution to have a review of access. So Section 94 is the important thing, emergency treatment. So we are aware that there are many psychiatric emergencies near immediate attention. So the emergency treatment is the thing. So the major things, like the major criteria to determine the case is the emergency, like the person is having a lack of capacity, the person is possessing harm to his children, to himself or others, and having a poor or neglected personal care, and the person is imposing harm to the property, like the properties and especially others. So social disturbance. So these are all considered as emergency treatment. The person can emergency treatment under. So the important thing is that this 94 is valid only for 6 hours. So after 72 hours, it should be reverted either to Section 80, most probably to Section 19 or 91. So, and then to Section 87 for treatment. And the age is for 87. So the important things to be kept in mind that it must be within 72 hours, and The ECT, electrocardiogram therapy, is not to be given under emergency treatment procedure, and it can be initiated by a medical practitioner. There is another advantage which is being given to the medical practitioners is that, like many individuals in this psychiatric facility, they have an emergency treatment. Like, it is important to know that if a psychiatric patient or mentally patient seeking admission to the primary center having a psychiatric emergency, he can must undergo there. That is not the last phase. There is no restriction to give an emergency psychiatric treatment to individual seeking care, devoid of the treatment setting. So we must not say that the person must be referred to a tertiary psychiatric facility. So important and immediate treatment should be found at restaurants or under facility. That is for the office. So coming to the section 95, we have some prohibited procedures like dialysis is absolutely prohibited to the section 7 and usually for minors around 20. It's prohibited partially. If it is needed, we can to be done only by the second facility has right to the review board or by a legal guardian. Only getting permission to the review board, we can talk to the institute. We can establish in any form to get and prohibited by law. And changing, the person must not change. That is another thing to be ordered. The physical restraints must be informed without a psychiatrist advice. That is another thing. So if the person is still violent or harming himself, we are nurse, we are not engaged to make the person secure or the restraint adult. We have to have a written order guiding take the psychiatrist to apply physical restraints or take motion which we need to do particular situation. And also psychosurgery is also partially prohibited for this like ECD for mental reactive right to the remote to have answers.
Hello, sir. Sorry to interrupt. Can you position your mic properly? The sound is a little bit blurring. Okay, please continue. Please continue, sir. Hello. Please continue, sir.
Research procedures. The section 80 says about the research procedures. Every individual after treatment can have like the research against medical advice. Everything is applicable for a person and illness. It is not recommended to personally teaching in the psychiatric similar establishment to a psychiatric mentally person under this act. The person currently gets discharged from the psychiatric facility if the drug is not satisfied or an emergency facility is not satisfactory facilities available in the particular establishment. So we have Form C, which is discharge request, which is available in the sources, and Form 4 minor and Form A for discharge request for elders. And coming to the chapter 13 says the responsibilities of other agencies. So, self-practice and the sector, also the sector. So we have cases from most of the time. Nowadays we are getting cases where the system offices they are highly the hospital. Magistrate or official responsibilities because chief official officer. So these are how things going as a team. So here section clearly describes the responsibilities of police officers after 20 years. So it is says that the police officers, if they see cases like a wanted in place, is making disturbing other people in the we can make the person produce before a magistrate and get a reception order, which is given under section 102. And the magistrate can order mental establishment to get the patient admission under booking. And so I think another responsibility is especially the concept that mental care at 2017 is the police officers have the right and has to file the FIR in case they are getting informed so that we can trace the wages at very early and we can rehabilitate the person sooner he pay out of his section 104, section 103 is applicable to forms of psychiatric division. So 103 is where the process produced before magistrate and magistrate ordering to have an inpatient treatment for the person. So and we have section 103 is applicable for the prisoners in mental health. So there are the mental treatment. There are many prisoners who are exhibiting for problems with mental health. So these the admission and discharge procedures answer to the first method which is mentioned at section 103. So these two cases, 102 and 103, the capacity assessment is done only after admission. So they will be specific, the magistrate will be specific about 10 days time. It is almost similar to the which is just mentioned in whether that register. So in 10 days, admission time is authorized by the magistrate comes and within these times we can perform a capacities and eligibility. We can support, we can give information to the executive magistrate will be also the user for status of the treatment rehabilitation or seeking rehabilitation or we have kind of the indigenous practice and trying to rehabilitation. Something that is report in this and ultimately instead of based upon this.
Hello, sir. Hello.
Yes, sir.
Sir, your voice is not properly audible. Voice is not properly audible. Can you position the mic properly?
No.
Okay, sir. Please continue.
So, in this slide, I was speaking about one of three sections on admission. So, which is one of these almost admission process, which is personalized for this before the district and getting a perception of the person's injury, mental facility for treatment, and it is a maximum for a period of 10 days. You can the solution and the problems to be integrated with consumers. And one of these prisoners and the person capacity assessment and the business triangles with exam application. So these are the things from the one session. So all these cases, 103, the capacity assessment can be finished within 10 days based on the perception. Am I clear now?
Hello.
Okay. Yes.
Hello.
Yes, sir. So we will go to the next slide.
Which slide?
So chapter 14 says restrictions to discharge functions like professional not covered by provisions. So it's mentioned that there are some different procedures and responsibilities are entitled to mental health professionals under this Act. So the person who are performing duties and responsibilities other than this specified at least coming under this chapter 14. So like for example, a clinical psychologist is not entitled to specify the psych of components. there are definite laws in responsibilities and duties is to be discharged in the professional lecture under this profession. And they often is mentioned in 15 and 16 chapters on miscellaneous. 16th chapter is on miscellaneous. The important and milestone law is there, like decriminalization of suicide. It is crime difference. It is on the crime difference which is in India 1987 and Medal Act 2013. So suicide is being decriminalized under Section 115. So it is recommended that it is the responsibility of the appropriate government to have provide appropriate treatment, facility for survival of the suicide. That is what law says under Section 1. So coming to the key differences, what where 1984 law and 2013 law are different. So coming to the mental area, the term being changed to hospital mental illness, hospital being changed to mental establishment. Like we have included PG practitioners, mental practitioners. That is often based change terminology, characteristics. And where the primary focus of the law, focus of law in 1987, where it was based to the right of hospitality. And primary responsibility is right state and central government errors. Primary responsibility is fundamental authority, state and authority, and legal side responsibility is liable to the ambulance involved. Then newer functions like ambulance knowledge capacity and decriminalization, suicide, emergency, and some newer functions which is being included under Mental Health Act 2000. These are the major key differences. So to the next previous slide.
We have few minutes only remaining.
The primary is like law is primarily actually rights of the person and all of the laws sections the laws around this. And we have a new option like others in our purposes. Right? And today in all facts it says that expert committee says that the important term of mental illness which is exclude mental retardation from the mental drawback. And if to the mental illness definition, it says substantial. Right? We have only practice of the make the patient with the mental illness. We have an evidence of statements on mental illness. So we have different patients with neuropsychiatric problems. So mental illness. So many of the time, it is like an iceberg where we see only severe illness, mental illness, treatment facility, and majority of the minor mental illness where go under. So that is what where the law these terms is clear intelligence. And we have included CMHA, SMHA, MHRB. So we need to use funding to establish. That is another drawback. And accepting others like you in a country like India is also another contradictory and important problem. These are the main drawbacks of MHCA. So now it's been taken.
Okay, thank you, Bivin sir, for sharing your valuable thoughts about the new Mental Health Care Act of 1947.
I'm sorry, sir, I can't hear you much.
Yeah, as the time is now short, we have to wind up the session. So, but still, I need to ask one question. See, this advanced directives. So, we told it is not applicable in case of an emergency, but still, the advanced directive can hinder the physician's preferred treatment, right? So that it may affect the quality of the treatment.
Actually, I'm sorry that the question is not much clear. Actually, what I heard is that advanced directive is not applicable in case of emergency. Actually, Emergency, the definition says like a primary criteria is like the person is having no capacity to make decisions. So if the person doesn't have a capacity, his advance directive is void.
Oh.
It is not valid.
But still, if ECT, consider in an advance directive, patient has told he don't want to receive the ECT, but consider patient is reaching an emergency situation and we have to start ECT. But if that advance directive was not there, we could have started ECT in advance itself, right?
I'm sorry, still the voice is not clear.
Okay. So anyway, doubts I will clarify through the email. So now as the time is over, we have to stop the streaming. Okay, so once again, thank you so much for sharing your valuable time with us. Okay, thank you. So we will end the meeting now.